and you're watching NDTV 24/7.
Hello and welcome to the special show Living Long and Healthy with COVID Vaccination. India is in the midst of the second wave of the COVID-19 pandemic, and it is different in many ways from the first wave in September 2020. The only way we can defeat this virus is through vaccination. And the good news here is that India has opened up vaccines for all over the age of 18 years from May 1st. Today we have experts with us who will answer any doubts of ours on vaccination. Let me introduce the guests to you. We have Dr. Chandrakant B. Chavan. He's a consultant cardiologist and electrophysiologist at Rhythm Heart Clinic, Pune. And Dr. Deepu Rajendran, consultant interventional cardiologist at Travancore Medical College Hospital, Kollam. Thank you so much, Doctor, for joining us and for being part of this wonderful initiative which seeks to address the concerns in people's minds with regards to the COVID-19 vaccination and also living in this new normal. So, Dr. Chandrakant, let me come to you first. What are the different technologies that are being used in Indian vaccines?
Presently in India, Ministry of India and Center for Drug Control Organization has given permission for two different vaccines in India. One is Covishield and the other is Covaxin. Covishield is one which is manufactured by Serum Institute of India, and Covaxin is the one which is manufactured by Bharat Biotech India. Covishield is a live attenuated vaccine wherein a live inactive adenovirus containing DNA which is encoded for a spike protein is used. So once this DNA enters the host cells, it will produce a spike proteins, and a human body forms antibodies against these spike proteins, and they will help you to protect against COVID infection. Whereas Covaxin is the one which is inactivated dead virus is used in this vaccine. So when the antibodies are produced, they are usually produced against
Dr. Chandan, let me ask you, how is the mRNA technology different from the technology which we are using in our vaccines in India? Can you explain that to us, please?
mRNA or messenger RNA, these are actually genetic material which tells the body cells how to manufacture certain proteins. So here in mRNA vaccines, what we do is we give artificial mRNA to the body in the form of vaccines, and these mRNA tells the cells in our body how to manufacture certain proteins of the COVID-19 virus. Especially the one that is used is the spike protein. And once a person is vaccinated, the cells in the body manufacture the spike proteins of the COVID-19 virus, and our immune system recognizes these spike proteins as foreign and attack against these spike proteins, and they learn how to deal with these spike proteins. And subsequently, if any of these persons who are vaccinated gets exposed to a COVID-19 virus, the immune system is able to tackle them early and efficiently so as to prevent infection by this COVID-19 virus. Currently, only two mRNA vaccines are available. One is by the Pfizer and the second by Moderna. Both of these are not available in India, and hopefully this will be soon made available to the general population.
As of now, we're still waiting, and when they're available to the general population. Dr. Chavan, tell me, are there any major differences in the efficacy and the safety between the vaccines based on the manufacturing process?
There are no major differences in safety and efficacy of these vaccines. Whenever a vaccine is being granted usage in a community, it goes through various clinical trial phases. That is a experimental phase, and there are different phases, phase 1, 2 and 3. After going through these rigorous protocols, only the vaccine is given permission. Covishield has finished all clinical trials based for the safety and efficacy, and it's allowed its uses now in our country. Covaxin, although it was granted an emergency uses after a phase 2 trial, but now presently Covaxin also has finished phase 3 trial data collection and has been published, and this also has been found to be more effective even against the mutants of the or newer mutants of the COVID virus. Both the vaccines are equally effective. More than 80% of the people treated with these vaccines will develop antibodies, and there are few breakthrough infections are seen but they are less common, and usually they are more common with the healthcare individuals where they are more exposed to the COVID-infected patients.
Okay, so that's for sure that we really need to understand that it's very, very important to take the vaccine to protect ourselves against this virus. Coming to you, Dr. Deepu, will the side effects be any different for the people with a heart condition or a cardiovascular disease?
Post-vaccination side effects most commonly encountered are the injection site pain, mild fever, general weakness, malaise, headache, all this. These are common in all group of population, and in patients with heart disease there is no increased incidence of side effects following vaccination. Only thing to be taken care is that persons with heart disease may many of them may be using blood thinners. In these patients it is advisable to not have a massage or rub at the injection site following vaccination. Instead, it is always advisable to have a sustained pressure at the injection site for 1 to 2 minutes because of the risk of local hematoma and swelling formation.
Okay, so I think that's a really good point which you've told us. Dr. Chavan, like Dr. Deepu has told us about heart, the cardiovascular problems. Can you tell us, is vaccination effective and safe in patients with uncontrolled hypertension? So should people continue with their medication on the day of the vaccine? There's a lot of confusion on this. Can you tell us about this, please?
Yes, sure. I think, as you said, there is a lot of confusion regarding use of vaccine in hypertension patients. Initial theories regarding experimental data which showed that angiotensin converting enzyme is the one which mediates this COVID infection process, and antihypertensive drugs are the one which are angiotensin converting enzyme inhibitors. However, this experimental data has not been translated into a clinical trial. So there has been no significant association has been shown with ACE, the angiotensin converting enzyme inhibitor antihypertensives, and COVID infection. Hence, patients should be treated with antihypertensive drugs adequately, as this is a subgroup which is more prone for infection, COVID-19 infection. And those who are taking vaccine also should take antihypertensive drugs on the day of vaccination. In fact, they should be adequately hydrated. One can take a food and take their antihypertensive doses as prescribed by the physician and go for vaccination with the free mind.
So we've understood about, if somebody has some heart issues or even if you're a hypertension patient. Dr. Deepu, is vaccination safe for people who've undergone a heart procedure?
Any heart patient, including those patients who had an angioplasty or a bypass or a valve surgery, they should be vaccinated. They are safe and the vaccines are safe. In fact, these persons with heart disease, including those who have undergone angioplasty or bypass surgery, these are the group who are most susceptible to a serious COVID infection. And hence, these persons should be given priority and vaccinated as a priority.
Thank you so much, Doctor. On that note, we're going to take a short break. Please stay tuned as we have a lot more coming up.
It's been a very, very challenging time for the government.
I don't think any of us, having lived through a period like this.
This is the biggest story breaking on the news.
This is a war-like situation. And when there's a war, the country comes together.
देश की रक्षा आपके त्याग, बलिदान, पुरुषार्थ के कारण और मजबूत होता है.
This is the most advanced fighter aircraft in Asia right now.
It's not about other people's opinions. It's about the facts.
अपनी सेफ्टी अपने हाथ में है.
देशभक्ति के तरीके से खून दें.
Fake news, what's that? Here's the news you can trust. A 30-minute wire to the latest in politics, sports.
Either you're up very late or I'm up very early. I don't know what it is, but thanks for being here.
Entertainment and the videos that are going viral. Watch the news at 8 p.m.
Only on NDTV 24/7.
News you can trust, news that matters.
NDTV wins the trust vote once again.
This is now the reality check.
NDTV 24/7 has been awarded the most trusted news brand of India.
Still many say independent, unbiased journalism of integrity.
Thank you for your endorsement of serious journalism. one thing that's clear, our world is changing forever.
NDTV, Rail News by Rail Journalists.
Protesters are storming the barricade. Many of them are carrying lathis, and the situation here is not good. This is what you can see here at the...
Welcome back. You're watching Living Long and Healthy with COVID vaccination. We have Dr. Chavan and Dr. Deepu who are answering all our doubts regarding vaccination as well as the COVID-19 pandemic. Dr. Chavan, coming to you, should patients undergo pending angioplasties which were postponed due to the earlier COVID-19 spike? Is it safer now to undergo these procedures considering we are now in the second wave?
Yeah, I think it's a good question. It is recommended normally to avoid all elective procedures when you have such a pandemic where human-to-human transmission is going to be very high. Hence, all elective procedures wherein you can conserve patients or give a conservative treatment to the patient and postpone the operation should be normally avoided. However, some patients will have a critical disease or some may require a primary angioplasty, or coronary angioplasty may be a life-saving procedure, or some cardiac procedure may be life-saving like permanent pacemaker implantation in certain situations. So these are the procedures which need to be conducted. You need to take COVID-appropriate protocols and conduct these procedures safely in these patients. Finally, the discretion whether to go ahead with the any procedure would depend on a treating physician and patient's criticalness of the disease at the presentation.
I think that's a very important point what you've said. We need to maintain COVID protocol, whether it's inside, if somebody's having a surgery, or even outside. Besides vaccination, another great way to protect yourself is to wear masks, maintain social distancing, and as well as, of course, we are saying use the vaccine and sanitize your surroundings. Dr. Deepu, your observations as to how have people managed heart disease and cardiovascular conditions during COVID-19?
It has been more than 1 year since we have been fighting this pandemic. And to be frank, most of the patients with heart disease have managed their disease well during this pandemic, at least reasonably well. With the routine use of teleconsultation and the frequent use of social media platforms like WhatsApp, most of them have managed their disease well. Going forward, my suggestion would be that in those persons who are on routine cardiac medications, they should closely interact with their physician or their cardiologist with over telephone or WhatsApp, and they can continue their medications as per their advice. But if any of them develop a new symptom, or if there is any worsening of symptom, it is always advisable to have an in-person consultation with their physician or cardiologist, irrespective of the COVID situation.
So we need to be in touch with the doctors. I think that's again very important point. Dr. Chavan, are there any changes in the home management guidelines for COVID-19 management? Can you share that with the viewers and us, please?
Yes, I think home management of COVID is usually for a milder form of disease. There have been a small changes in the home management of COVID-19 infection being there. Usually patients with the milder symptoms are prescribed this home management. Once you are home quarantine, it is usually advisable you need to be in a separate room with a separate bathroom. SMS protocol, that means social distancing, continuously wearing mask, and frequent sanitization needs to be followed very strictly. Oxygen saturation monitoring needs to be done. There is a small change in the protocol in the sense you need to do a 6-minute walk test to detect the lung involvement early. That means at a milder pace, you can walk for 6 minutes and you are getting a drop in the saturation, and this needs to be monitored frequently, maybe 2 to 3 times in a day. As well as drugs, whatever prescribed by the physicians, antiviral drugs needs to be taken strictly, and you need to come in contact with the physicians, preferably on a daily basis when you are home quarantine.
Okay, so you've explained us, what a person should do if they are home quarantined. Dr. Deepu, tell us, when should a person, who's diagnosed with COVID-19 think of hospitalization? Many times one just panics or the oxygen saturation level is going down. When is that time when one should actually think of going to the hospital?
Now, the second wave of the pandemic is raging and the hospital beds are in short, oxygen supply is short. We are hearing all the news. So the decision on hospitalization is, of course, a very crucial thing. There is no confusion regarding one group of persons, that is persons who are severely ill and significant symptoms with a saturation less than 90%. When the oxygen saturation falls below 90%, the patient must be hospitalized. If the person is totally asymptomatic and if the oxygen saturations are normal, there is no need for hospitalization. Then patient can undergo home isolation. In between, when the patient has milder symptoms or mild or moderate symptoms, and if the patient has has comorbidities, significant comorbidities, which predispose a person to severe COVID infection, like uncontrolled diabetes, severe obesity, heart disease, lung disease, previous stroke, all these persons should consider hospitalization, be evaluated by a physician, and then decide on hospitalization.
Okay, so those are some important points. Dr. Chavan, I want to ask you something. Coming back to vaccines, Covishield initially was said that the gap between the two jabs need to be about 4 to 6 weeks, and now they've increased that from 6 to 8 weeks. Can you tell us why has that been done? Because again, a lot of people are confused asking why.
Okay, I think this is because of the post-vaccination, there has been some data that has been coming ahead, and wherein it has been observed when the second vaccine dose, when it is given after 6 to 8 weeks of the first dose, the antibody response, that means the antibody titers which are found in these patients are little higher than the person who is taking vaccine 4 weeks later. So it means that it is adding or it is boosting the immunity further if there is a separation of doses of about 6 to 8 weeks for Covishield. So it is recommended nowadays to take the vaccine, usually the second dose of Covishield vaccine, usually 6 to 8 weeks after the first vaccination, which initially was 4 weeks.
So Dr. Deepu, the other thing about vaccines, many times what happens is a person takes a vaccine. In fact, a colleague of ours here in office, the same thing happened, has taken the first shot and then starts developing symptoms. But one also thinks it's, it's a part of the vaccine. I mean, it's, just a follow-up, like people have a body ache. So then how does a person know when to do the test? Because there's a lot of confusion on that as well.
Almost all persons who have been vaccinated will have mild fever, generalized weakness, headache, and all these are common even for a COVID infection. So the thing we can say is, for following vaccination, the symptoms never last more than 72 hours. So if it persists for more than 72 hours, you have to consider other causes for this symptoms, and the patient should consider being evaluated by a physician or being checked for a COVID RT-PCR or an antigen test as recommended by the local protocol.
Dr. Chavan, another thing a lot of people want to know is, now because people have got their second jab as well, they're still getting COVID-19 or they're getting infected. Is it milder that once you've had both the jabs?
Yes, I think those who have received both the doses of vaccine, usually after 15 days of last vaccine dose, patients develop good immunity. Hence, if you catch a COVID infection by any chance, you don't tend to develop any serious symptoms. You usually don't require even hospitalization in such a situation. And the most important thing that is prevented is you are prevented from going to the death table. So I think that is what needs to be kept in my mind. And you need to take both the doses of vaccine as prescribed by the government guidelines.
Dr. Deepu, another thing which I would like to ask again with vaccination, is it true that the immunity when you get your second vaccine, it's gone down? Is that true?
No, the second dose of vaccine doesn't immediately provide immunity. Actually, the vaccine is effective. Second dose, the immunity appears after 14 days. That is what Sir has already mentioned. That post the second dose, more than after 15 days is the time we have maximum immunity against COVID infection. And we don't know how long the immunity will last. As of now, there are no data to suggest how long the immunity will last, whether we will need a subsequent dose or not. But as of now, we have to take the second dose of vaccine.
Okay, so Dr. Deepu, I just want to ask you another thing. You all have explained us really well about, the vaccines, why it's important, how one should deal with, if somebody has infection, whether they're home quarantined and when they need to go to the hospital. I have another question here, Dr. Deepu. Is it safe, vaccination safe for a patient who's had a stroke? Should we watch out for any specific symptoms?
Yes, vaccination is perfectly safe in patients who had a stroke. As I had previously said, stroke is a high condition. Patients with previous stroke are predisposed to the serious COVID infections, and vaccination definitely decreases the risk of having a COVID infection, and more importantly, definitely decreases the chance of having a serious COVID infection. So all patients who previously had a stroke should definitely have vaccination taken, and both the doses to be taken as prescribed. And there are no additional side effects compared to the general population in a person with previous stroke.
Thank you, Dr. Deepu and Dr. Chavan, for taking time out and answering all those doubts and questions regarding the vaccines. As we end the show, a little reminder as well as a request to all our viewers to please get themselves vaccinated.